I'd like to present Circa Therapeutics. So many of you have asked me, what are you doing with your startup? And so I wanted to give you a glimpse of what I'm doing. This is not part of the startup showcase for the scoring, but I would definitely appreciate our judges giving me feedback. Obviously, I have conflict of interest with being the organizer of the conference. I don't want to decrease the chances of other people getting that credit. So with that, I will start my presentation. Okay, set my timer. All right. Hello, everyone. My name is Yuli Cheripalli. I am the founder of Circa Therapeutics. Circa Therapeutics is about 6 months old, so it's a very early stage company. This is my daughter, Siri. She has autism. One of the challenges with autism is that it is very hard to treat. It is very hard to control symptoms, and the therapy can be painful. So Circa Therapeutics would like to make therapy fun. So as our target disease, autism spectrum disorder, it's the second most common condition of neurodevelopmental disorders, and about 7 million people have it currently in the USA, and it's growing at a 10% per year rate. And so it's a lifelong condition. It's not curable. So the problem we are trying to solve is that it needs 20 to 40 hours a week of therapy, one-on-one therapy, and there are not enough therapists available currently in the market. It costs anywhere from $60,000 to $250,000 per year, this kind of treatment. And so the access to care and total cost of care is the problem we are trying to solve. So our solution is a device system. It's based on advanced robotics, virtual reality, video gaming, and machine learning. We are calling this the cognitive sensory motor therapy. So it's a brand new type of therapy, and it is a digital therapeutic. Of course, we have the hardware and then the software. So here's a demo of our prototype. I'll start playing. And this is Siri, my daughter, who is trying this machine for the first time. And the device itself is a robotic device. As you can see, it has moving parts, and it's more like an exercise machine where the patient has to pedal and also steer with their arms and hands. She's wearing a VR goggles and a headset. So it's a fully immersive experience. Let me go back, see why this is not playing. There you go. So the robot itself moves. It has 6 degrees of freedom. So the patient is placed into this video game virtually. So whatever she's doing on the machine is reflected in the game. There she hit a rock, and so she can feel the rock in the device because you will feel the jolt. You'll feel the road conditions. So she has to stay on track and complete the task. So one of the things that you feel is the road conditions and everything that happens in the video game. So this is what we call task-oriented therapy. So here is our hypothesis. If you combine physical exercise and mental exercise, what it does is it'll trigger the hormones, the feel-good hormones, right? And then it'll also decrease the stress hormones and the cortisol and all. So these effects of exercise, physical and mental, we hypothesize that it'll decrease the symptoms. And if you use it for long term, it'll increase neuroplasticity, creating new connections in the brain, which will eventually decrease symptoms. The current market size is, we think, obtainable market is about 0.5 billion. And it's, like I said, it's growing at about 10% per year. We don't know the cause. The current treatment is the competition. The current treatment is ABA therapy, applied behavior analysis. This is the kind of treatment, the speech therapy and occupational therapy. These are the ones that take 20 to 40 hours a week. Of course, we have drugs, but there's nothing specific to autism. These are generic antipsychotics, antidepressants with their known side effects. And on the technology side, we have a company called Akili that came up with a video game as a treatment for ADHD. And this is a prescription therapeutic. It was approved by the FDA. Of course, we can translate the behavior therapy into virtual reality, and that's what Florio is doing. But what Circa is doing is it is creating a new digital therapeutic category, and that's the category that I talked about. So we think it'll take about 3 to 4 years to do the clinical trials, and we're starting the first trial in the fourth quarter. We already have, the machines ready. We assume that each machine will generate about $150,000 a year in revenue. And we base that on about $200 a pop for one session. And it will be initially paid by the patients or the patient's family. But as we get the clinical studies done, as we get the FDA process done, we think that eventually it'll be a prescription therapeutic. This is our founding team. You know me. I have been the chief medical officer at Torque3, which actually designed the machine, and I helped with the clinical process. They are designing it for stroke therapy, and we are licensing that hardware technology, and we're going to build the software on top. Izzy Kohler is a doctor of physical therapy. She has ran clinics before, and she's also a PhD student in human performance. So she's our science person. And our technologist is Raj. He has run other healthcare startups. He's a serial entrepreneur. And also he was a partner with his wife in this spine clinics. There was a chain of clinics that he was running and managing. In summary, we are raising $2 million. It's an early stage digital therapeutic. We've already raised, the friends and family round about $200,000, but our seed round is going to be about 2 million. This is for the clinical stage, clinical studies, pilot studies, build a team, build the technology, and apply for grants and FDA process. And also we will have our IP strategy done with this money. So it's an early stage company. It's a new digital therapeutic, and it's a great team. It's pilot ready, MVP, and it's in a rapidly growing market. So if anybody is interested in investing or knowing more about it, you can contact me. Thank you very much. I'll stop sharing and I'll wait for feedback. Let's see. Let's start with Dana.
Hey, I'm the lucky one. Well, first of all, thank you for bringing attention to this and actually trying to innovate in that area. I wasn't aware of all the statistics, but I just knew it's a big problem as I have connections and families. Do you envision this to have, and I know you have to go through your clinical trial, but this could be a combination of that digital therapy plus the drugs plus in person, right? Okay, yeah. So that would be part of the way you would be looking at it. All right, that would make sense. The other things I was thinking of as I was watching that video, because there are physical challenges with kids with autism, and I think having all that physical motor things could be an issue. Is there's an age where you think that therapy applies to?
So initially, we're going to start with age 12 and above. So one of the things that we have seen, with other patients is that since an autistic kid's world is so restricted that they are tied to a room. Because they cannot go out and play. And so I have seen patients where their muscles have atrophied because they cannot get out and ride a bike, like, for example, or play soccer, because their social interactions are so limited and their behavior is prohibitive to typical play. And that's one of the reasons why I think that a physical activity machine is needed, number one. Number two, since it is run by software, we can design it as easy as possible when they first start and then gradually increase the resistance. And it has to be safe, right? So, when they sit in the machine, they are safe. They cannot fall off. You cannot teach them how to ride a bike because of the behaviors and difficulty in managing these kids.
Yep.
Okay, thanks. Vince, any comments, questions, critiques?
My thoughts are, how do we actually, after this gamification of the machine, how do we actually talk to the person who was actually feeling it? How to get their thoughts, like pre and post? And then other thing would be that how frequently we need this. That was not clear, or maybe I missed it. And how frequently, it's a once a week thing or a twice a week thing, or kind of.
Yeah, that will be decided by the pilot studies. We think, again, this is guessing, 3 to 5 times a week. We think that as technology progresses, as technology becomes cheaper, that these machines will be placed in people's homes. They'll buy one machine and have it in the home. To answer the second question is, how do you know whether the patient likes it or not? That's a very difficult one. Some autistic kids can communicate, can say yes or no, like or don't like, but we will go more with the caretakers or the parents who are with the patient to see if they're interested in coming to the clinic for this therapy. If they start screaming no or something, then we know they don't like it. The second thing is we will be monitoring their symptoms. For example, aggressive behaviors. Is it affecting their aggressive behavior? Sleep, is it affecting their sleep? How is it affecting their sleep? Anxiety, and then focus. We think that there'll be some positive indication in any of these 4 areas, but we may be surprised that we might find something else that it helps. I know that with experience with my daughter is that the more physical activity she gets, the calmer she gets.
Yes.
And so we know that physical therapy, but with literature and also, practically, we have seen that her symptoms have decreased. And that's another reason why I was so interested in this technology.
So in summary, in last 6 months, your daughter is feeling much better overall.
No, she has not used it every day. She has only tried it once, and that's when I asked her, do you want to do one more time? And she said yes. So that was the indication. In the last 6 months, we're still building the device, and we are partnering with the manufacturing company that is actually making the device. So Circa will not be manufacturing, we'll be just licensing, the hardware and the VR piece. The experience that we have is for the last 7-8 years since Siri, we have her in a very intensive physical exercise program, which involves circuit training, weightlifting, boxing, and all those kinds of activities, which really help her. It was so good that her anxiety levels came down. We could wean her off of her medication, and she lost about 30 pounds. So I know that exercise has a very positive impact on the symptoms.
Thank you. Thank you, Yuli. Yes. But I can give you one inspiration that a few years ago in 2015, when Benioff Children's Hospital was inaugurated in Oakland, so many kids would go under that, the big GE machine, which just slides it, and they were quite scared because there will be nobody. When I say nobody, means there will be no family members around them. So, but your concept is more friendly because you could be with your loved ones right in front.
Right in front.
That kind of reduces anxiety and also gives more inspiration to family members and their kids to connect more. So I think that. So I cannot say user interface, but I can obviously say it's a great user interface as compared to the G one.
Yeah, we haven't started actually making the games yet. These are just generic games that we put it into the machine.
The initial start is very positive and is very welcoming and is very promising. So thank you, Lee, for doing it.
Thank you. Doreen?
Yes, so I want to comment here. I saw it last year as well. And I know when it comes to our children, we expose a lot of grit and a lot of passion. So I can see that, Uli. And I think not only children with autism might benefit from it. I believe too, exercise is one of the key ingredients here, but it has actually shown like ADHD children can focus during that time they're playing video games. So maybe broaden that. And then instead of asking parents to pay for it, we here have so-called play groups. These are parents coming together. So they have a facility where my child was part of that as well. And so they're coming together. So maybe they're together as a community could purchase something like this, and many kids could benefit from it at the same time.
Sure.
So that might be another idea, or hospitals then. So I think $150 for one parent, for one family might be very steep if at the beginning they have to pay for it themselves. So maybe we're looking for a community or a hospital or another organization.
Good point. Good point. Thank you.
My pleasure.
Okay. Thank you very much, judges.